Significant variations in autism spectrum disorder, ASD, prevalence were observed across different communities. This disparity is likely linked to variations in early detection and diagnostic practices. Some communities, like California, have implemented initiatives to improve early identification and referral, potentially leading to higher prevalence rates. Factors like insurance coverage and eligibility criteria for services also influence access to early intervention. In contrast, while Puerto Rico had a high prevalence in younger children, the rate among older children fell below the network average. Dedicated efforts in Puerto Rico to enhance early identification programs appear to be contributing to this difference. Across all communities, ASD prevalence showed a pattern of higher rates among children of racial ethnic minority groups and lower socioeconomic status compared to white children. This trend differs from past findings and likely reflects increased access to services. However, the pattern isn't uniform, with some sites still showing higher ASD prevalence in higher socioeconomic areas among minority groups. This suggests ongoing disparities in identification practices. Differences in health outcomes, like higher ASD and intellectual disability rates in minority groups, may be influenced by social determinants of health, such as income, housing, and transportation barriers. These factors could also affect access to therapy. ASD continues to be significantly more prevalent in boys than girls, although the difference is narrowing. This difference could be influenced by variability in identification practices, and the decreasing ratio might not indicate actual improvement in identification for girls. Early identification efforts show marked improvement over time in the ADDM network. This is evident in the higher identification rates for younger children compared to older children. COVID-19 did not appear to have a sustained effect on early ASD identification in the most recent data. While some temporary changes in evaluations might have occurred, the overall trend in identification remained consistent. Despite comprehensive evaluations, suspected ASD cases remain lower than identified cases, suggesting potential delays or discrepancies in primary care diagnosis, raising issues about the accessibility of diagnosis and services for early detection and intervention. If you like our content, don't forget to like and subscribe to our channel, News Today.